Hi, my name is Emma Rary, and I'm a student at the Rollins School of Public Health at Emory University, and I'm here to talk about my work with Wish for Wash, an Atlanta-based organization that applies innovation and design thinking to global health and particularly to wash problems. The research team for this project includes Jasmine Burton, the Wish for Wash founder, Sarah Anderson, Tanvi Suresh, and Brandon Philbrick. So we wanted to explore the concept of smart sanitation and how technological innovation can impact the sanitation sector. So we conducted a literature review of biosensors being used in sanitation. We wanted to see where this technology was being applied, where it's being developed and implemented, and the potential it has to impact global health. So biosensor is just a biological device, a technological device that takes biological input and converts it into measurable electric signals. In the context of sanitation, it could detect something like a specific bacteria or enzyme, and sanitation is a really promising field for biosensors for a couple of reasons. One, they can operate on-site in real time, which can be an improvement over traditional sampling that often is just intermittent and could have to be taken back to a lab for analysis. And additionally, biosensors can be read remotely, which limits the amount of human contact with the sample, which is great when you're looking at wastewater. So where are people actually using and developing these biosensors? Well, we found two broad categories, one at the individual level and others at the community level. So for individual level data, you might see a biosensor applied in a personal toilet or a latrine. We found them for uses such as personal health monitoring, diagnosis, and for applications in research studies such as how often are people using a latrine that is newly implemented. Biosensors at the community level were often found in community sewers, and this is in fact where most of the biosensor technology we found is being implemented. And here they're often used for surveillance. Some examples include tracking illicit drug usage or monitoring certain bacteria or hormones. Many of these technologies are still in the pilot stages and face problems such as needing regular battery changes or reagents, and difficulty scaling up because they're designed to detect very small quantities of material, and sewage can be a very complex matrix. But despite this, they have a lot of potential to improve health system strengthening by strengthening community surveillance and detecting changes in health in real time, and potentially providing personal health information to individuals who don't have ready access to a healthcare facility.